Welcome to Psyched for Psychology, a Nystrom & Associates podcast. Our hosts, Michelle Iverson and Brett Cushing, are both licensed marriage and family therapists at Nystrom & Associates. Each week, they talk about all things mental health and therapy, and you get a chance to dive into specific psychology topics that help promote personal development and wellness. And now, here are your hosts, Michelle and Brett.
Thank you for joining us again today. We had a really interesting topic that we wanted to talk about We did a previous podcast episode talking about psychosis and talking about that comparison of, psychosis and how it's depicted in movies and then what we actually see in reality. So if you haven't listened to that episode, feel free to check it out. And that got both of us thinking about other portrayals of therapists, of therapy in general, of different mental health disorders and concerns in media overall.
You can tell we like media because the first thing we jumped off with was we were highlighting Friends, right?
Yes.
And some of the Friends episodes.
Yes, and one of our very first podcasts that we did.
Exactly, yeah. And that was a lot of fun. So we like media and we appreciate how important media is. We look, and this would be another episode for us to do is social media and kind of the benefits and the liabilities that go along with that, how it affects mental health detrimentally. But we also know that media, it does form our opinions of things, and it's highly influential on whether or not we're going to pursue something or shy away from it based on how things are portrayed in the media. So, for instance, I remember growing up, we were just talking about this when I was growing up as a little kiddo, watching the show or the movie Jaws, and absolutely terrified me to go into any ocean. I didn't even like going in a lake. I didn't even want to go underwater taking a bath in the bathtub because it was so terrifying. And that shaped my understanding of, the beach and the ocean and even sharks in general. I mean, people are now trying to conserve sharks because there's such a negative influence on the way people perceive sharks. And so that's kind of a fair analogy, I think, as it relates to therapists. Sometimes therapists are portrayed, and therapy in general is portrayed a certain way. And we want to address that. And we understand it might help people maybe move towards therapy better rather than moving away because of the way it's portrayed in the media.
And to think more critically when you see a therapist, a therapy session, or even a mental health concern depicted, shown in a TV show or a movie. We want people to think critically about that because one thing I was thinking about is why is it so hard for us as therapists when we're watching a show or a movie? Why is it so hard for us to find a good, accurate depiction of what therapy is really like? It's because we're trying to dramatize something that really shouldn't be seen as dramatic. This idea that somebody coming to therapy is being normalized rather than something that can be kind of blown up out of proportion, exaggerated for a show.
Right. Yeah. We need more examples. And I'm hearing more of that from people who go into therapy and they talk about it very openly. Yeah, we see a therapist and she's great, or, really we go and we've learned such good things. So it's becoming more normalized, but historically, and I think through media, it's been seen dramatized and more exceptional rather than normal. So hopefully we'll be able to normalize this a little bit better for people as well.
Yes. And feel free to just take these as just our personal opinions. Other people might have other opinions on it too, but this is just kind of what we've seen and what we've noticed as we think about all these different categories we're going to talk about.
Absolutely. Thanks for that disclaimer. Because even as I share, Michelle, you might disagree with my experience. And that's okay. You can be wrong. I'm okay
I'm the wrong one. Okay. Let's see how
so,
that is.
as Megamind would say, another media example, he would always say, you were right. I was less right. So we can all be a little bit less right, and that's okay.
So we're going to talk a little bit first about our favorite and our least favorite depictions of a therapist. I'm going to kick things off with my personal least favorite, which is funny because it's actually from a show I really, really like. So there's a show on Netflix. I think it first started on Fox or something, got canceled, got renewed, brought back on Netflix, because the show's got this super passionate fan base, because it is a very, very funny and interesting show. It's called Lucifer. So hold on. Let me explain. This is a show that does not take itself very seriously. It's all about the devil himself coming to Earth to run a nightclub in LA. Then he decides he wants to be a consultant to the LAPD to help them solve murders and catch bad guys.
Fascinating.
So, interesting concept, right? But good show, very funny. But the thing that always made me cringe and get frustrated the most was the depiction of therapy. So he goes to a therapist in the very first episode, and therapy actually became a very consistent thing throughout the show. The therapist is one of the main characters. She's this Dr. Linda Martin, like this supposedly like one of the best psychologists in LA. But she breaks about every therapist rule in the book. Every single ethical code that you and I get trained in, that we operate on, that we would absolutely lose our license over, or maybe even could go to jail over.
Can you think of anything like she's done in particular?
Oh, yes.
Because I think that would be helpful for people to know.
Let's see. Had sex with her client.
Oh.
Yeah, big one.
Wow.
She ends up being in relationships with like her client's best friend, had a baby with that person. When we think about dual and multiple relationships, that's a very big thing in therapy. Ethically, we need to hold a standard of we do not have multiple relationships with the client in terms of I can't both work with you as my client and also like own a business with you
why
at the
not?
same time.
What's the big deal? It seems pretty convenient.
Yeah, well, let's think about that. What would it be like to have a person who holds in a way all of your secrets and all of your vulnerabilities, and then could potentially then now use them, hopefully not against you, but like could use them in a way in which that would not feel comfortable for you as a client. So if I were to like use you as like, I have you as my client, but I'm going to use you as like my babysitter for my kid, right? That could put you into this really, really tough spot of how do I navigate if I want to say, no, I can't babysit your kid today. And then how that could affect the therapy. Like there's so many reasons in which we don't want to have those dual and multiple relationships.
Good point. Yeah.
But she was doing this all the time, all throughout the show.
All the time. Wow.
If she had one person as her client, there would be one session where she might have a session with that client, and the next session might be the client and all their friends, all in the room at the same time.
Yeah, and people watch that and think,
watch it.
That's cool.
And
like,
and I certainly would hope, given how I described the show, nobody would take that seriously. But as a therapist, that would always be the stuff that would make me go, ooh.
Yeah, well, it's drilled into us in particular that you don't do this, and there's reasons why you don't do it. And yet, I think sometimes for clients, there is a close relationship. And so it is important to have boundaries so clients understand I'm not your friend. And it's interesting. I can care a lot about my clients and not be their friend. And that's difficult sometimes because we want a deeper connection. And therapy in itself is a very intimate thing because people are sharing, the sides of them that they don't share with other people. And so that is very intimate. And people, I think, want their therapist to be their friend. So it kind of highlights how easily that can happen. And yet it is frustrating because it's really drilled into us. Nope, those are understandable ethical violations.
So from the character perspective, this makes this my least favorite by far, clearly. But I will highlight, there is actually some cool things about the show and how it talks about therapy that I do like. So like one thing that I do like, it does a really nice job of like just normalizing going to therapy, right? The main character going to therapy in the first episode and continuing to go. And for that character, because like they want a better understanding of themselves and like to become self-actualized, to figure out like, who am I really and my place in the world and what does that mean for me? not because he feels like he has to go because he's broken or damaged. Really normalizes that idea of anybody going, right? Even if, in his case, he's got a wonderful life and like all the things he wants, but he still feels like something's missing and he wants help to find that. I think that's really cool.
That's a great point. And I'm glad you mentioned that too, because it is one of the barriers. We hear a lot within our field, like, hey, we need to normalize this. And yet in our medical model, one of the critiques of our industry is that we pathologize everything. Who wants to be pathologized? Like, I'm here, I have this disorder, I have this problem, and I like the way it's depicted there. You know, we can destigmatize it as we don't focus on pathologizing everything and normalizing. I think that's a great, profound point.
And then at the end, the main character himself, guess what he becomes and he decides to do for his job?
No way.
A therapist.
A therapist. Well, and and that's a really good point. For people who are listening, ask your therapist, have you ever been in therapy? I've been in therapy.
Yeah.
I think it's just kind of a normal thing. And the best therapists, I think, are the ones who've been in therapy. You take the pain and the things you've learned and you're able to share that with other people. It's kind of like in college, some of the best professors are the ones that aren't full-time professors, but they're in the field, whatever field they're studying, and they're telling you hands-on what they're learning. So that's a really good point. And I encourage people, ask your therapist, hey, have you been in therapy?
Absolutely. I have too. And I think it makes us be better therapists by doing so. And again, because of even just those reasons that I did appreciate with that show, not because somebody is that broken, damaged, all that, untrue kind of stigma around going to therapy and why people go, but people going because they're seeking a better understanding of themselves and working on that self-actualization, which I think is a really great goal for everyone to work on.
And that's actually a great segue into the next one. You ready to move into the next one?
Yeah,
because I know your favorite one.
My favorite one
is a great example of somebody who has had a tremendous amount of pain, and he was able to work through a lot of his pain, and that helped him to connect and have significant influence. It's your favorite. It's actually one of my favorites as well. Yeah. Who's that for you?
So we're talking about Dr. Sean Maguire in Good Will Hunting. So this is Robin Williams' character. So we both really like this example. Some very famous therapists in the field really like this example too. We really like him because for a number of reasons. For one, for me, the therapy that he does in the movie is not in because I see this all the time, some picture perfect, like immaculate therapy office where, this therapist almost looks like they're in this power of like authority and position, where they're kind of portrayed as this know-it-all with the perfect answers. It kind of does away with that myth, which I really appreciate. He's very down to earth. His office is like in the basement of the college, which feels very accurate. But he also emphasizes like the importance and need of like that therapeutic relationship and being authentic with Matt Damon's character. There's some things that, of course, are dramatized. This is the problem, of course, with movies. He certainly overshares with his character. I do appreciate that he cries with his client, can also challenge his client, but also there are some points where he becomes very confrontational. And again, let's chalk that up to being a movie. Clearly, that is not okay in real life and with real therapists. But I think if we take away that dramatization of it being a movie, overall, it is one of the nicest depictions of just real interactions between therapist and client, rather than putting the therapist on some type of pedestal.
Yeah, that's powerful. And that's what I really take away from it too, is the connection, because the number one indicator of successful therapy is still that relationship with the therapist, that rapport. Yeah. And it's really nicely depicted in that movie where Robin Williams' character is there's some hierarchy, and you see Matt Damon's character kind of like interviewing all these other therapists, and you can see this hierarchy and this elitism that some of the other therapists seem to have. Whereas Robin Williams, there was no hierarchy, but instead there was solidarity. Yeah. There was solidarity with his client. And I think Robin Williams' character, his own pain really enabled that solidarity and that connection that is so incredibly powerful in the movie, powerful in real life, even outside of therapy. When we connect with people, and look at soldiers when they have gone into battle, maybe they weren't even in the same platoon, but they can look at each other and they just know. And that's a form of intimacy that I was talking about earlier, that I think with Matt Damon's character and the pain that he had and the pain that Robin Williams had because he grew up in a similar environment, it's powerful and it's intimate, and that's where real change can happen.
Absolutely. What do you think is your favorite therapist portrayal?
Well, I like him, Dr. Sean McGuire. I like Bob Wiley in What About Bob? Now, many people might think, well, he wasn't the therapist, but if you remember at the end of the movie, he became a therapist and he wrote a book on, what was it, like, death therapy or real therapy or something. And we started with Richard Dreyfuss, who played that role so great. He was absolutely hilarious. And you saw the elitism. He's behind this big desk and he's got his suit and, he's got his beard. And
it makes it intimidating.
Very intimidating, and he was all about himself and he was all about his book, baby steps. And Bob Wiley, he became a therapist. How? It was through his own journey. And he worked through a lot of stuff, a very endearing character. But I think it also highlighted that therapists are we're regular people. We're not this sage, that knows everything. And we're people, because of our own journeys, we're regular people. We're happy to get into the mire and the muck and the filth of life, and sometimes to sit with people, because even that can be very powerful. That the Richard Dreyfuss character really didn't espouse very well at all. But I really like Bob Wiley. He's somebody that is very endearing, and I think he could obviously have a greater connection. And he did throughout the movie. He had a great connection with everybody, but Richard Dreyfuss' character had a connection with virtually nobody. So I really liked him, but also speaking along those lines, for people who have maybe grown up like I did watching MASH. MASH was about this mobile army surgical hospital and the trauma. It was a comedy, but there was a lot of trauma in there.
I was going to say, there were kind of some dark moments in that show.
Absolutely. Yeah, they had a really nice balance. And you can tell humor is important to me. And so I think it's important to our mental health. That's why I connect with it. And we did do a podcast, if people have never watched that, is entitled, Is Laughter Really the Best Medicine? And it's very popular, so you probably want to check that out. But while MASH was funny, there were times they had a therapist represented, Dr. Friedman. Yeah, Sigmund. It's almost sounded like Sigmund Freud. I can't remember his name, actually. But Dr. Friedman, and he was able to, he had such a peaceful, calm presence about him in the midst of people who were experiencing severe trauma and PTSD. And he was able to have this calm presence where people trusted him. And he didn't have to even say much. He could just have an observation and share an observation, and you could see people connect with it right away, and it would penetrate their heart, their mind. And that's when truth kind of pervaded and started to free people up a little bit. And I love that as a therapist, when I can have those opportunities to sit back and have a moment of clarity because I have some distance from it versus the client, and be able to share an observation or a thought, or even ask a question where people, they see it for the first time and they say, I'd never thought of this. And it's so incredibly freeing. For me as a therapist, I'd do this for free if I could my whole life, just for those moments. And that's what I think that doctor, that therapist really epitomized in MASH.
Great. What about movies? Like, what are some our favorite movies and shows dealing with mental health concerns?
Great one. Yeah, I'm a big fan of Inside Out.
Yeah, me too.
I thought that was terrific. I loved how creative it was and how they were able to depict emotions, because we don't really understand emotions a lot. We don't understand. We tend to categorize them as good or bad. And they sort of did that in the mind of the character, the main character. And sadness was bad. And it really kind of sucked you into believing that sadness was bad. And, you know, they even had sadness look kind of mopey and unappealing. And yet sadness was the hero. Mm-hmm. And embracing that was really the catalyst for change, because we know suppressing those emotions like sadness and anger really leads to depression, for instance. Mm-hmm. And so they did a masterful job of highlighting how sadness needs to be embraced, and that can be the hero for us. So it was a quote kid movie, but I thought it was profoundly masterfully done.
Well, it's become a really great teaching tool for kids as well too. I mean, what a way to be able to help kids to better vocalize and understand what's happening with their emotions and their feelings. It's been used a lot. I know a number of child therapists and psychologists that have referenced Inside Out a lot when they're working with kids.
In fact, now that we're talking about it, this Friday we do these recordings, and I usually have Fridays off. I think I'm going to go home. I'm going to grab a frozen pizza, and I'm going to watch Inside Out, because it's such a profound movie, and it's so well done.
Well, when I was thinking about it, we did talk about this one and why it's one of my favorites on our psychosis podcast. Mm-hmm. But I'm going to talk about it again. Yeah. Silver Linings Playbook. Wonderful movie. It's there's some inaccuracies, but overall positive message. A realistic portrayal. What I've heard from clients when they've described this movie gets me when I talk about, or I'm trying to help other people understand my bipolar disorder. And what I like about it too, the other thing that we see a lot in families is, you know, bipolar disorder affects the person, but it also affects the family unit and the system. And I really like how it portrays that family system going through that struggle together. Mm-hmm. And sometimes even like reaching a crisis point. That is kind of the underlying theme of the movie. What is it like for that family to go through this together and reach that crisis point together? You've got Pat, that's Bradley Cooper. He gets released from a psychiatric hospital after he's been there on like an 8-month commitment. Because you end up finding, hopefully I don't ruin this movie for people, but you end up finding out that he had assaulted his wife's lover. His dad, that's Robert De Niro, he's obsessed with the Philadelphia Eagles and gambling. Might have some like OCD and rage issues of his own. Mom's pretty passive, just kind of like watching over what kind of feels like a powder keg at times, trying to keep it from exploding. So a lot of dynamics that sometimes we'll see happening in families. He falls in love with Jennifer Lawrence. She's the young widow with depression, sort of implied that she might have borderline personality disorder. Not explicitly said. We do have a podcast on that if you ever want to learn more about that. But essentially there's my concerns with it. There are, again, dramatized, exaggerated, aggressive outbursts. Most people don't engage in that behavior. Most people will really kind of see, though, that what the movie does show, not the aggression piece, but what the movie does show, when they're having a manic episode, they're not acting like themselves, right? They're not doing the things that they would typically do. And in reality, they're more likely to hurt themselves or maybe engage in other types of impulsive behavior, like spending all your money, verbal arguments with people, quitting your job to travel the world with no plans on how to do it, right? Usually things that are going to have more harm on themselves, but can affect the family too. Some people kind of criticize the movie as like, oh, this is just like a cliche romance. But I would argue, how often do we get to see characters who have mental health concerns get a happy ending with each other?
Yeah.
And so what I thought was most powerful too was like who was behind writing the book, creating the movie. And I found some really great kind of quotes from the authors. Well, the author of the book, he said this: I grew up in a blue-collar neighborhood. We didn't talk about depression. Nobody even said that word, especially in the 80s. In retrospect, I was definitely dealing with depression in high school, in college, but I was so afraid to talk about that. And when I hit 30, to use the phrase that Bradley Cooper uses in the movie, I felt like I was white-knuckling it. I wasn't doing the things I wanted to do. I wasn't living a healthy lifestyle. I wasn't talking about my emotions. And that just sort of exploded onto the page when he was writing the book. Mm. In the mental health community, so many people have written me now saying, how did you know this is my life? And the director wanted to make the movie because of his own son, who happens to have bipolar disorder and OCD. And he said, I wanted to treat these characters as humanely as possible. I want people to feel the humanity of the characters. So I appreciate how this normalizes relationships, the impacts of the family, and just reminding people beautiful things happen too. This is the silver linings and the cloud aspects, that it gives people a safe place to start the conversation about mental illness. There's a silver lining to having mental illness too. The way our brains are wired creates problems, but they can also create beautiful things. And I love that message from the author.
Yeah, that is powerful. And that is, it really captures a lot of what happens in therapy is we have these really awful things that have happened. And through the process of learning and growing, those, not to diminish the awful and painful things, but they actually can become something beautiful at the same time. Yeah. Yeah, there's still pain, but there's still progress and growth. And it sounds like that really captures that well, which, is really important too, because therapy isn't just about thinking positive things. That really is an insult, I think, to people's pain. We need to validate that. Can I share with you the most surprising one for me?
Yeah.
Because I am bursting. This is so exciting for me.
Yeah.
It's a beautiful day in the neighborhood. Did you see it?
Yeah, I have not seen it yet.
Oh, my goodness.
I have heard so many good things.
Oh, you've got to tell me what you think. I was surprised. I loved Mr. Rogers because I grew up watching Mr. Rogers, and that's what this is about. It's a beautiful day in the neighborhood. It's about Mr. Rogers and one particular client. It's based on a true story. It's one, I said client because I see him as the therapist in there, but it's this one individual who really had a lot of pain in his life, a lot of anger, but really it was a lot of sadness and a lot of fear that are the primary emotions, and the secondary emotion of anger was just so pervasive in this person. And he was sent to do an interview for the magazine that he worked for on Mr. Rogers. And he thought, why in the world would I want to do this? And so he goes there with all his anger. And Mr. Rogers, Fred Rogers,
he was just an amazing guy.
He was. I mean, he epitomizes what I want to be as a therapist because he really was this person, and this is true life too, because I kind of indirectly know somebody who knew Mr. Rogers, and that person said, that's the real deal. And what I loved about him that he inspires me to be as a therapist was this intense, relentless pursuit of thinking positively and having positive regard for other people, no matter who it is. You could not get him off his game.
Right. When you become a therapist and you go through grad school and you're learning about it, that's actually a term we talk about unconditional positive regard. As part of therapy and that process that we need to learn how to do as therapists. And he just naturally had it.
He did. Naturally, supernaturally, he had it in spades. And that was inspiring for me. I also felt like by the end of the movie, I felt like it raised so many questions and issues for me in my own life. I felt like I had gone through just an incredible therapy session myself. And I had seen it with someone older than me, my wife, and then my son who was younger. And it just crossed generational lines. We all felt like, wow, I just went through some really intense therapy. This really affected me. And what I also liked at the end of it, he talked about, like, somebody had asked him, I think it was, do you ever get really bogged down by all the pain you see in people? And he said he does, and he just kind of bangs on his piano because he used to play piano. And you see this happy ending, and you see how he was so elated over this person having freedom from all his anger and all his pain. But you also see Fred Rogers back in his home at the piano and just banging on the really low keys of the piano. And as if he carried all of that weight of that person, and he was letting go of it. And I thought that's something people don't see as therapists, that we do carry pain. We care about our clients. And so there is that pain that we carry with our clients. And sometimes they don't even see hope. And so we hold on to that for them. But it was just on so many levels, incredibly surprising. I can't wait for you to see it.
I was going to say, yeah, you probably didn't realize going into the movie that you're going to have a therapy session.
No idea.
Lo and behold.
Yeah, it was great.
All right. Well, when we think about surprising for me, I brought my son to one of his first movies in the movie theater. Big deal.
Yeah.
And I was looking at, like what's kind of out right now? Disney movies tend to be sure thing, right? So what's out for a Disney movie? And it was Encanto, had just been released.
Oh.
I was like, okay, this looks cute. Not quite sure what it's about, but let's go check it out. Let's go see. My son did okay. He was pretty fidgety in his seat. We weren't sure if we were going to get through the whole thing, but we made it. But what most surprised me was here I was thinking kind of like with Inside Out, like, oh, okay, cute, like Disney movie, like how's this going to go? And probably about 20, 30 minutes in, my therapist ears pick up and I'm like, what am I catching on to here? Because what I ended up finding out, this is just like Inside Out, very, very complex dynamics and themes. As a therapist, like for me, I was like, I've got so many people who are going to resonate with this. And that ended up being the case. I mean, the movie's been out for a bit now. And we've been seeing all of these therapists, especially ones that kind of come from a Latinx background, discussing like how much they appreciate discussion of intergenerational trauma. For families of immigrants, the burden of making the family proud, keeping the family struggles at home. They were seeing all of those themes in that movie. And then how that affects the entire movie is about how that affects the mental health of kids and of the entire family unit. The entire movie is about encouraging vulnerability, about not being perfect. And so many first generation kids of immigrants have been seeing themselves in these characters in this movie. So as a couple of examples, if you haven't seen the movie yet, please do. It's wonderful. But to give some examples, if we take the character of the abuela, she's protecting her home and her family is her priority after she experiences trauma. She loses her home. She loses her husband. There's some really great, the movie is set in Colombia. So they did a great job of pulling in some really just like factual information around like the upheaval and what was happening at that time. But throughout the movie, she thinks she's being protective of her family and she's not seeing the harm it's causing until near the end of the movie. Have you heard the song We Don't Talk About Bruno? That was actually on the radio for a little bit because this character Bruno, who's like my favorite in the movie, there's an entire song about not talking about him. He's this mysterious figure and like nobody talks about this guy in the family. He's representative of family secrets, which again, common when there's intergenerational trauma. That it reinforces, it's like it's not okay to talk about these secrets, talk about feelings. So this is a really popular song in this movie. And it talks about how we might inadvertently teach that to younger kids because the older people who might know something about Bruno and what happened with Bruno are singing the song and kind of teaching the younger generation, we don't talk about him.
Wow.
Right. And then you end up finding out later, Bruno was there and he so much wanted to be part of the family, but he felt he had to protect his family by staying away. Then you've got Luisa. So this is one of the first songs in the movie that really caught my eye. I was like, oh, this is about mental health. I like this. Luisa was literally a depiction of she's carrying the family burden on her shoulders. And that's what her song was all about. And about what it's like to experience anxiety because that's what her character is going through. Isabella is a perfectionist, and so her song is all about how she can't fail, she cannot let the family down, and she also experiences her own anxiety around this. And then finally, the main character, Maribel. She is the only one in the family that does not get a gift. Everybody else in the family, and that's the whole kind of theme of the movie, everybody gets a gift, a special power, and she doesn't. And so what is it like to be a part of a family that's got all of these superpowers and these special gifts and magic? And she doesn't get any of that, but we end up learning she ends up being the key to the family healing from the trauma that they experience and then the glue that keeps them together. She's also part of kind of showing a younger generation trying to communicate with older generations of trying to be seen, acknowledged, and kind of valued for who they are.
A lot of entry points for people to connect on that. I can see why that really resonates with you. And hopefully people, as you've been listening to this, you not only have a whole new list of movies to go see, but it gives you all a sense of what kind of therapist do I want to see? And what do I want to experience in therapy? What are some elements? So we hope that you are able to come away with some real practical things and really, as we said at the outset, just normalize this, that everybody's struggling with somebody. In fact, there was a great, I can't remember the guy, he was on the radio, but he always ended his radio podcast. He said, be patient with everybody because we are all struggling with something. And these movies really, I think, illustrate that and motivate us to go see a good therapist.
And maybe go see a good movie this weekend.
And go see a good movie. And you know what else they can do? They can also like and what else?
Share and subscribe.
There we go. Like, share, and subscribe to our podcast. We would love that. And share the good news with other people.
Yeah, we appreciate you all listening and check in with us soon. We'll be glad to see you soon.
Thank you as always for listening, and please be sure to leave us a review. While this podcast can't be a replacement for therapy, we hope you enjoyed our discussion today and join us again next time. Nystrom & Associates is always available to those who are struggling. If you find yourself in need of support and help, please check us out at nystromcounseling.com.